Within the NHS, there's often this rhetoric around getting patients involved in decision making. And as you've experienced probably through the complaints procedure, it doesn't always work. And the mechanisms have been set up for patients to get involved, but it's very confusing. There are so many avenues to get involved in decision making that you just feel as though often you're banging your head against a brick wall because you're shouting to the wrong person, rather than having a discussion or a dialogue with the right person. And it's understandably very difficult to understand who that right person is, because everybody's saying, talk to me. So you start having a conversation with you, and then they say, well, I can't do anything about that. And that just is so very confusing and frustrating. So what we're talking about later on this afternoon, and Barclay and Phil are going to talk about in a lot more detail, is the immediacy, I suppose, of where treatment can be improved. And that immediacy is in the next 12 months, things are going to go through NICE, medicines are going to go through NICE, and NICE is an organisation that is very powerful within the NHS, and it makes independent decisions on what treatments are made available, not just the medicines, but just treatments in general. And as a kind of quick, it's not necessarily the right term to use, but a quick, easier win is to see how we can influence the decision that NICE might make on treatments that is of benefit to you. So we're going to talk with Phil and Barclay on how NICE works and what ways you can get involved in decision making that will be effective. Now, the NHS is open, and I've not experienced it in the last, I don't know how many years I've been in this kind of game, 20, 30 years, I suppose. No, not that long, 20 years, of working with, majority of the time working with patient organisations. They've always been smaller organisations. Heart UK, we built up an image of it being this huge organisation, but actually there's not that many of us. But we do tend to pick our fights, and we have learned how to marshal the troops. We've learned how to make that voice heard by channeling it in the right way. So I want to share with you some of that, and that's what today is all about, is using your voice effectively. So the complaints procedure is probably a grassroots way of getting involved that might affect your direct everyday care. What perhaps we're talking about today is that more strategic or the governmental sort of level, not necessarily the political one, but the governmental level at NICE to get involved.
Can I ask one question?
Please do.
Just for those who can't remember, what does NICE mean?
NICE is the National Institute of Clinical, and then there's somewhere in there social, National Institute of Clinical Excellence.
Well, I thought it was, but
Yeah.
just in case some of these
Yeah.
didn't realise what it meant, I thought I'd just bring it up, because you're using acronyms again.
Yeah, no, that's fine. But Barclay will be talking more about NICE itself, but NICE in effect is a decision-making body made up of health economists, doctors, and other so-called experts, none of whom necessarily have patient experience in it, to make decisions in a committee. And I've had experience of sitting on various committees. You get invited in as an external expert to share your experience, and you have an influence upon the decisions. And I know NICE comes under a lot of criticism, and I'm one of those that make the criticisms of it as an organisation. It's probably one of the better ones, because it does come up with a balanced, at the end of the day, decision on what is economically effective, as well as what works, as well as what is good for the patient's experience. So it's got a difficult job, in fairness to it, to balance out what can we as a nation afford over what would benefit a patient. So, but
to add to that, we were talking last night about some of the drug trials. NICE are the body that will decide whether or not to licence a new drug in the UK on the NHS. So which is why patient voice in these respects are really important.
Yeah.
If they don't license, they pay
They
for it.
They agree, yeah,
So,
they
because it's
approve.
licensed by the EMA,
Yeah.
and
Yes,
then they will
agree to pay for it on
Yes.
the NHS. So
yes, yeah.
it's, which is why it's really important to have the patient voice here, as we were talking about yesterday, because, you know, some of these drugs are really expensive, but they're only going to help a small number of people in the community, and so the relative costs are quite low, but we need to convince them why it's important and how much of an impact it's going to make even to a small number of people.
But-
They do take the patient voice very seriously.
They do.
I've been involved with the stroke guidelines, and the actual guidelines in one particular aspect were influenced very strongly by one patient standing up and making her voice heard.
Yes. Because what will happen, I don't want to steal the thunder from Phil, is that NICE is made up of there's a room twice the length of this room, and it's quite intimidating. You're sat in a kind of a horseshoe of professors and, you know, academics and other, you know, you just might be in awe or frightened of, but they have an expertise in mental health, they might have expertise in elderly care, they might have might be a health economist. Nobody around that table will know anything about FCS. Nobody will have the remotest idea of what it's like. Nobody will have the remotest idea of your everyday life. And they're inviting you along to share that. And I think they are very genuine. And Doreen quite rightly says, and as well as my experience, it's the patient whose story influences that decision. I'm not necessarily sitting on a committee, but saying your piece, you know, and sharing it either through Heart UK and many other instances, or through the LPLD Alliance, acting as a mailbox. You might not think that your story is important, or you might not want to share more than a paragraph, but we can collate all that, and you can't underestimate the value that NICE places on those contributions. So to emphasise how important it is to get involved and share your stories, but don't say, oh, it's okay, you know, I'm in and out of hospital, but I manage. You know, things are terrible, but I get by. It's really to tell people the way that it is. You know, if they were in your shoes, what would it be like? You know, what decision would they make if they were you? You never talk about economics, you never talk about the price of the medicine. Most of the time you don't even know, because at the end of the decision, NICE and the drug company will have a bit of a fight, and they'll argue over the price, and it's never made public. So you will never know, well, you might hear from the doctors, how much the NHS is actually paying for a medicine. So, you know, it might be £1 million. By the time it's gone through the whole NICE machinery and they've argued over the price, it might be £100. You know, they're quite tough on the way that they negotiate prices.
But I want to quote an advert, you know, I'm worth it.
Yeah.
It's £1 million, I'm worth it,
Yeah.
sorry. And I think it's
Yeah.
really important to hold that, because actually the...
But don't get drawn into the
Yeah.
economics or the price. Don't even mention it. Don't.
That's not our issue
No,
at
it's
all.
not your problem.
CCGs can choose not to use.
No, they can't. Once they come out with a decision about a drug, the NHS is obliged to fund it.
No, I don't think so.
Yeah.
I mean, I'm
By law.
And there's certain drugs that are available on prescription that in our area we don't.
That's slightly different. If NICE have come out with a technology, what's called a technology appraisal for a medicine, they are given us a couple of months to find the money for that. They are obliged by law. So if there are things that have gone through NICE that have ended up with a technology appraisal, and NICE have said, thou shalt receive this medicine, by law, you have got to get it. And if you don't receive that medicine, then you can challenge them.
Well, just like in our area, there's lots of things that we don't prescribe
Yeah.
and things, but then also things that are for diabetics, you know, the new blood glucose monitor.
So I'm just wondering
we
what
don't
would be-
prescribe,
why
we don't
was
prescribe that in
I
our
was just
area.
going to bring that
Not every medicine has gone through NICE.
Okay.
Will only be those that have got a technology appraisal. Now, the most recent one I've got experience of, forgive me, all you know, Heart UK always talking about FH, but is the PCSK9, which is a new sort of drug to reduce cholesterol. and it's not a statin. It's hugely effective. It was quite pricey, and it wasn't accepted in many places around the world, and it was quite a fight to get through for NICE, but we got there eventually after a bit of a campaign and a bit of a fight. And then it was accepted that it ought to be prescribed through lipid clinics, but that's fine, but at least patients were getting access to this medicine. Now, 12 months, 18 months on, patients are still not getting access to this medicine, despite it being hugely effective, despite it being approved. And patients are being denied what they have a legal right to have. Is CCG will use the excuse to say, well, we can't afford it, we haven't got the money for it. It's not your problem, you know. It's not your, you know, it might be your fight, but together, you know, we might be able to help ease that fight and burden of having to badger them all the time. But you've got an absolute right, legal right, to get a medicine that has got a technology appraisal, as you know, some things now are going through that decision-making process. So if anybody does have problems accessing a medicine, you know, in a few years' time, whenever things go through, you know, that's when we might have another workshop like this to say, well, how do we do it? You know, because CCGs, there's this committee that's made up mostly of the GPs, and they have budgetary control over that, your local area. They will decide, you know, what referrals are made. We hear that many places now are restricting the number of referrals, so GPs can't make a referral to hospital to a specialist. That's been restricted by somebody at the CCG saying, well, we don't think this is an appropriate referral. Now, that's when you kind of have a different role in your local area to put influence on that committee to change the way that it behaves. And it's more than likely those that are quiet and timid, and the conditions that are unknown or people don't think it's a problem, are the ones that are a victim of this, because they can get away with it. You know, nobody's going to make a fuss about it. So if you make a bit of a fuss about it, you make a bit of a noise, then you're more than likely to not be ignored. You will find, you know, that different areas, geography, different CCGs, and there are a couple of hundred of them, will make different decisions. So don't assume when we're talking about the National Health Service that it is a national decision that is made and everybody receives the same level of care, the same medicine, the same treatment where you live, because it is very determined on where you live. And what the newspapers call as the postcode lottery or the postcode prescribing is real. But it really depends on how you want to get involved, on what is there decided, or on the decisions that are local to you.
Can I say there's an added element when you're a rare disease, because your doctor that you see may not be kind of up on stuff.
Yes.
You know, and so
yes.
It's therefore beholden on you to say, I've heard about this.
Yes.
Can you look into this, please? So there's
yes.
an element whereby you have to be an expert patient, an expert in your condition,
yes.
in order to kind of promote your own kind of care, really.
Yes, that's right. Yeah. It's not just one way. It's not that, you know, you're not just a receiver of services. You know, to be an effective advocate and a good patient, you also need to be informed, as you all are, but be confident enough to have that discussion, as I'm sure you do. But it's important equally to share with others how you've experienced it, so that they have the confidence to challenge. You know, nobody challenges more than you might do with the food here,
yes.
or an event, and quite rightly so, because people have no idea.
No idea.
You know, no idea at all. So when we're talking about advocacy and lobbying or influencing decisions, it's not just nice, you know, although that's what we'll emphasise perhaps a little bit more upon today, and that kind of decision-making process.